I'm Elaine Haher. I'm the team lead for the Digital Health Catalyst for TM Forum. And digital health has been meaning for a while under the Open Digital program in the IoT section, so the Internet of Things. We have focused over the past few catalysts on looking to utilize the frameworks or the digital framework standards, but also to apply those standards in an Internet of Things way. So being able to build the value fabric where we're taking the parties from the health industry, from the medical device industry, combined with operator capabilities to solve a business problem for either an enterprise or a consumer. So our last focus was on providing care at home and being able to provide monitoring of a patient's health in their home utilizing devices in their home. So we had a care at home application where we could order a product offering, and that product offering would either be a premium or a medium type of offering or a basic offering. So being able to order from an application as opposed to coming to an operator on a self-care site and being able to place that order from that application and then have the devices shipped to the patient's home and then start to collect and monitor the data and analyze that data. We, in our previous catalyst, had the capability to authenticate access to the data so that when a nurse practitioner visited the patient at home when their readings were out of whack, we would be able to authenticate the ability for them to access the data as well. So that was our previous catalyst. So what we're looking to do now is to take the approach that we still have a large government agency like the National Health Society and give them the capability to provide this care at home, but to add the use case of loneliness in the home, and how do we utilize some of the monitoring capabilities to determine better ways to handle loneliness in the home, provide new features on the application for those types of problems, because there's a lot of focus on as the population ages, the loneliness increases. So we've been working with Sutter Health out of Palo Alto, and they're going to become part of our catalyst this time. So we're going to have the input from the health industry on this aging at home use case, and they've been focusing in that area, and they're going to help us improve the application that we've put together. In addition to adding the loneliness in the home use case, we'll be also adding the capabilities for the digital frameworks, so more digital frameworks capabilities. So we'll be adding the APIs for billing and being able to handle multi-party billing, charging, and settlement. So how do we pay, how do we collect the money from the patient, how do we collect the money from the insurer, and then how do we distribute the revenues out to the different parties. So it's a complex catalyst in that, you know, we have the original catalyst that has all of the catalog management APIs, the ordering APIs, and now we'll add the charging, billing, and settlement APIs. So that's the frameworks kind of thread. And then our additional use case of loneliness in the home, where we're bringing in a healthcare supplier, Sutter Health. So that's our goal this time.
Great. So who should come and see you in Nice? Who you know, what you're going to be demonstrating, and who would be ideal candidates to come and see that?
You know, it doesn't necessarily have to be a healthcare-oriented person who comes to the Catalyst, but we expect, like the previous Catalyst, that we'll see the operators that are reaching out into the Internet of Things, and some of them are focused on healthcare and are looking for new ideas in that space. But I also think that if you're looking to understand the digital frameworks and how you can apply some of these APIs that we've done in the API governance program to your Internet of Things program, we can also take it from that generic view of, yeah, this is how two catalogs interconnect and communicate. This is how we federate data between catalogs. This is how we take an order and distribute that order across systems. This is how we charge, bill, and settle against multi-parties in a collaborative way. So I think you can gain a lot of value even if you're not focused on the digital health space.
Great. Thank you very much.
Sure.
Thank you.